Our healthcare workers are tired, they're suffering, and they don't want to see another person die alone of a preventable infection.
As Utah sets another record for daily case counts of COVID-19, hospitals and healthcare workers are feeling the strain. That record new number, 1,501 positive cases today from a record number of tests, 10,302. Close to 82,000 positive cases in Utah over the course of the pandemic.
It comes as Utah surpasses 500 deaths, with health officials reporting 5 more today. We have team coverage tonight looking at where we're seeing a decrease in cases and what the governor is saying about trick-or-treating this Halloween.
We begin with news specialist Garna Mejia. Garna, an urgent concern that our healthcare system could soon be facing a crisis.
Yeah, good evening, Deanie, and that's right, a crisis if our ICUs continue to reach max capacity. Some are already at 95%. It's why health officials, including those at today's governor's COVID-19 press briefing, made an impassioned plea calling for the community to wear masks, saying it's not about politics, but about saving lives.
We have great leadership, but people are really tired.
Health officials from the state's major healthcare providers weighing in to say the spike in COVID-19 cases is not a path we can afford.
And now our hospitalizations across the Intermountain Network is higher than it's ever been. So we're setting now daily records of hospitalizations of COVID-19 patients.
Doctors say the spike in hospitalizations follows a recent spike in COVID-19 cases seen among young adults.
The 15 to 24-year-olds are taking those infections home with them and then spreading into mom, dad, grandma, grandpa.
The Utah Hospital Association says there are about 96 ICU beds currently available in the state. Here's a breakdown for each of the major healthcare providers, showing they have a total max capacity of 457 beds to treat COVID-19 patients. But the bigger concern is not having enough doctors to care for the sick.
Highly skilled individuals who care for high-intensity COVID patients have been doing this for 7 months. They're tired, they're busy, they're frustrated.
And they don't want to see another person die alone of a preventable infection.
If the upward trend continues, it could easily overwhelm medical resources as the flu season kicks off.
We cannot handle a severe flu pandemic at the same time as a COVID pandemic. Just can't. We don't have the hospital. We don't have the healthcare workers. We don't have the capacity in our hospitals. If that were to happen, you're going to see makeshift hospitals being set up.
The solution, though simple, could make all the difference.
It's masking, it's hand washing, it's being cognizant of not touching your face. It's all of those things in conjunction with one another.
Now, those 457 ICU beds being used to treat COVID-19 patients are also used for other patients. So overwhelming those resources has a ripple effect across the board. For now, we'll send it back to you.
Garna Mejia live for us tonight. Thank you, Garna. In the midst of a pandemic, we're entering another critical phase, flu season.
It's time to get your flu shot.
Today, Salt Lake County Mayor Jenny Wilson got her flu shot and is challenging everyone to do the same. She says it's more important than ever as we fight COVID-19 to help lessen the burden on our healthcare system.
It's going to help your health, but it's also going to help our public health system in this pandemic year and then in this year of challenge.
Flu vaccines recommended for everyone 6 months and older, especially those at high risk like the elderly, pregnant women, and anyone with a compromised immune system.
Also today, state health leaders focused on some success in this pandemic in Utah. News specialist Mike Hedrick joins us live. Mike, they used Utah County today as an example of what we can do together as a community with a renewed focus.
Yeah, pretty interesting, huh, Deanie? Because you think about it 30 days ago when talking about Utah County, it was a completely different story. They were not the shining example that they kind of talked about today. Of course, the governor and other state leaders were talking about those record numbers in cases that we've seen, and especially the record number of hospitalizations that we've seen today. But it wasn't all doom and gloom, and that's the good news. As mentioned there, Utah County kind of being that bright spot. And talking about the numbers that we've seen there, it's been reported actually for several weeks now how Utah County became somewhat of a hot spot as the entire state has seen a surge in cases. Well, at the beginning of that surge, Utah County had 40% of the state's cases, despite the fact it only makes up roughly 20% of Utah's population. Well, for the past week, Utah County cases have dropped, now accounting for 30% of the state's new COVID cases. State epidemiologist Angela Dunn says it is encouraging.
They reignited their commitment to stop unnecessary illness and death, and this has worked. Let's all use this as an example for statewide action moving forward.
Also, a topic of discussion today was Halloween. Now, a lot of people are wondering how it's going to look this year after the CDC discouraged traditional door-to-door trick-or-treating. Now, the governor weighed in, giving a few instructions of his own.
If you have a mask you're wearing for your Halloween costume, that doesn't help protect you or the others from spreading of the aerosols and the COVID-19 virus. So if you have a Halloween mask, wear a mask underneath it, a real mask that will help you with that spread.
And you can never have too many masks on Halloween, right? The governor also said parents should not let their kids eat candy until they come home from trick-or-treating. So then, as a parent, you can wipe it down, disinfect at least the wrapper part of it, and then your kid can eat it. The key is here, Deanie, the kids still get to go out there trick-or-treating and get their candy. Back to you.
That's right, and I will give a special close look to any dark chocolate that our kids happen to get. Kevin?